Welcome to the Health Promotion and Disease Prevention Track. My name is Pamela Staples, and I am the Public Health Program Manager for United South and Eastern Tribes, working with the Good Health and Wellness in Indian Country project. Today, Dr. Shiree Southerland will be delivering an interactive presentation entitled Understanding Heart Disease and Promotion Wellness, a conversation to get you moving. Dr. Shiree Southerland has over 21 years of public and community health experience. Her experience has been gained primarily through working for local, state, and federal departments of health in the areas of program development, project management, quality improvement, and program evaluation. Additionally, Dr. Southerland maintains her clinical practice as a bedside nurse, working at a large, well-known research and teaching hospital in the Baltimore area, primarily practicing in the areas of medicine, research, hospice, palliative care, and surgical oncology. Throughout her career, Dr. Southerland also continues to teach at the university level, both online and face-to-face courses in the areas of public health, liberal arts, gerontology, behavioral health, and nursing at several universities. We'd like to extend a sincere welcome to Dr. Shiree Southerland. Thank you.
Good morning, everyone. I'm delighted to be here and sharing with you a topic that is near and dear to my heart, which is how do we maintain and keep ourselves healthy? How do we prevent heart disease? Because as you know, it is the #1 killer in the US. So I'm going to pull up my slides now. Share my screen. Okay, so I'm going to go over our objectives for our presentation today. Our objectives. So upon completion of this webinar, I anticipate that you will be able to identify factors related to heart disease, to describe some of the effects that heart disease has on your individual wellness, list strategies for managing and preventing heart disease, as well as demonstrate at least 2 low-impact exercises to promote wellness. And don't worry, I'm not going to have anybody doing jumping jacks or anything like that, or having you to turn your cameras on. So it'll be something that, again, is very low impact. So what is heart disease? This is a term that we hear all the time, you know, coronary artery disease, heart disease. So what exactly is heart disease? I mean, obviously it is a disease of the heart, but what exactly does that mean in terms of, you know, how does it really affect the heart? So we have 3 major types of coronary heart disease. We have our coronary artery disease, and that's, you know, our arteries are the vessels that carry blood away from the heart. And so you have plaque that builds up within these arteries. And so unfortunately, when too much plaque builds up and the arteries are closed off in your heart, then that's what causes a heart attack. And unfortunately, during this time, part of the heart muscle dies as well. And so we also have associated with heart disease are our peripheral arteries, and that would be our arteries in our arms and legs. And so again, they can become clogged and called peripheral artery disease, which in some cases, depending on how severe it is, individuals may lose circulation in their limbs, and they may have to have it amputated, but that's in the most severe case. And then lastly would be our carotid artery, and our carotid artery is here in our neck. And so plaque, again, can build up within that artery. And of course, where's this blood going to? It's going to your head. So, you know, having that artery clogged would have a decrease or a stoppage of blood flow to your brain. And so a heart attack can occur when any of those arteries become clogged. And so what puts you at risk for heart disease? Well, risk factors are what puts you at risk for heart disease. There are certain things that we have control over that put us at risk, and then we have things that we don't have control over that puts us at risk for heart disease as well. So what are our non-modifiable versus modifiable risk factors for heart disease? So unfortunately, the non-modifiable ones are those factors that you can't change. Age, as much as we would like to reverse age, we can't. So the older you get, unfortunately, the greater chances of you developing heart disease increases with age. Your gender, men have a higher risk of heart disease, and after menopause, the risk for women gets closer to that risk that is for men. And then, of course, our genes or our race. We know that there are certain racial and ethnic groups that have higher rates of heart disease, that being African Americans, Mexican Americans, American Indians, Hawaiians, and some Asian Americans also have a higher risk for heart problems as well. So these are those things that you have absolutely no control over. The ones that we do have control over are called our modifiable risk factors. And these are things that you can change. And so, say for instance, you are in a race, ethnic category where your risk of heart disease is higher, or based upon, you know, your gender, your risk is higher. So adding on top of those risk factors that you have no control over, you add these modifiable ones can really put you at a dangerous level of being prone to getting heart disease. So not smoking. If you do smoke, quit. There's a lot of great things out there, aids now, to assist you with stopping smoking. And I know a lot of insurance companies give individuals a lot of incentives with smoking cessation. They provide a lot of resources and incentives because, you know, let's face it, it's in the interest of the insurance companies to keep those insured as healthy as possible. So they do provide a lot of resources and support. So if you do smoke, I would encourage you, if your insurance company hasn't reached out to you, to reach out to them and see what things that they have available that can assist you with quitting smoking. And of course, controlling your cholesterol through diet, of course, exercise, and of course, if you do have high cholesterol, being compliant with your medications. Another biggie is if you do have hypertension, controlling high blood pressure. There are an enormous amount of individuals who have high blood pressure on blood pressure medication, and their blood pressure is still not controlled. So I would encourage you that if you don't have a blood pressure machine, to get one, because the only way you'll know whether or not your blood pressure is controlled or not controlled is to monitor and track it and take it every day. And again, I go back to your insurance companies. It's within their best interest to keep you as healthy as possible. So I know my insurance company actually reached out to me indicating that because I had a diagnosis of hypertension, that I was eligible to receive a free blood pressure cuff. And I had my doctor fill out a form, and the insurance company mailed me out a free blood pressure machine, a really nice blood pressure machine. So, you know, again, check with your insurance company to see what aids and things that they also provide as well. And of course, if you have diabetes is another biggie. As a nurse, I see a lot of individuals with who are on diabetes medication, but yet their blood sugars still are insanely high. So having uncontrolled diabetes definitely puts you at greater risk for heart disease, because diabetes, much like hypertension, those are diseases that control our vessels and the constriction of our vessels. And so when you have more pressure, say with uncontrolled blood pressure, then that definitely leaves you at a greater risk for heart attack and stroke. Same thing with diabetes. Again, it has a great effect on our vessels. So that's why you see a lot of individuals who may have lost their vision or lost their limbs due to uncontrolled diabetes. And diabetes and high blood pressure, those are the two biggest risk factors for individuals ending up on dialysis, and that is uncontrolled. That means you're not taking your medication, you're not managing your blood sugars. Those are two of the greatest risks for individuals to end up on dialysis. Things that you can change, of course, you can exercise more. We all can exercise more. I know COVID came and made us a lot more stay inside and whatnot. And so now a lot of us are now just getting back out in the world. So 30 minutes a day is certainly something that you could consider doing. Same thing with keeping a healthy weight by eating healthy foods. So you can exercise all day, every day, but if you're not having a good, nice, well-balanced diet, then your exercising is going to be in vain. So those two go hand in hand, exercising and eating well as well. And then, of course, learning healthy ways to cope with stress. I don't know about you, but over the last year and a half with COVID, stress levels in my house have been through the roof. So learning how to deal with those. And we're going to talk about meditation at the end of the presentation as well. And that helps certainly with stress control. And also limiting how much alcohol you drink, no more than 1 drink a day for women and 2 a day for men. And you really must be very specific. So no more than 4 to 6 ounces, because what I consider a drink and what someone else might consider a drink might be vastly different. I might consider 4 ounces and someone might consider 12 ounces of wine, a standard drink. So no more than about 4 to 6 ounces if you're looking at wine per day. So what is coronary heart disease? As we talked about, you see how over time you have a little bit of buildup of plaque over time. Again, that could be due to those non-modifiable risk factors. However, the modifiable ones, your smoking, your high-fat diet, increased cholesterol, will lead to more and more plaque building up. And as you can see, at some point, the artery becomes occluded or closed off. And so when there's no blood flow, things die, be it your heart muscle, be it your leg, but wherever that blood was supposed to go, that area becomes compromised. And you hope it's not in your heart or your brain. What could be the effects of coronary heart disease? With less blood flow to your heart, the heart doesn't get the oxygen that it needs and can cause chest pain, otherwise known as angina. Of course, as I said, without it, your cells won't work as well. And if plaque breaks off and totally blocks an artery, you can have a heart attack. And also too, when you think about plaque and arteries and all that stuff, especially we're talking about in your heart specifically, if you do have some of that plaque that breaks off, you have a risk of it traveling from your heart to your head and causing a stroke as well. So that's again another effect of coronary heart disease. How can it affect men and women differently? Women and men present with not chest pains, but signs of a heart attack. Signs and symptoms of a heart attack are different in men and women. And unfortunately, a lot of women go misdiagnosed when it comes to catching and identifying a heart attack early in the process. Men are more likely to have intense chest pain, and women may just get tightness or pressure in their chest, and just kind of maybe ignore it, thinking that it's not, all that, serious or big of a deal. They may feel uncomfortable, like when a meal doesn't sit right with you, and sometimes can be very tired, shortness of breath, and nausea. So I ask you, does that look like the signs and symptoms of a heart attack? It could be signs and symptoms of quite a number of things. Of course, intense chest pain, yeah, you think instantly about your heart. But when you have some of these more vague symptoms in women, that's why sometimes it can be missed and diagnosed later when women are having a heart attack as well. So why should you bother eating a well-balanced diet? Heart disease and stroke are America's #1 and #3 killers. And eating a good diet helps to reduce those controllable risk factors that we talked about. So maintaining your healthy weight. If you have high cholesterol, knowing what your cholesterol levels are, taking medication if you have to, maintaining a normal blood pressure, maintaining normal blood sugar levels, as well as, decreasing physical inactivity and also use of and exposure to different tobacco products. So how do I get started? Focus on those things that you can change. Think about those risk factors that you have control over, like adopting better dietary habits, consuming the right amounts of fruits and vegetables, and things like that. So these are recommendations to reduce your risk. I'm sorry, I had to move my little thing because I couldn't see the slides. Recommendations to reduce your risk: eating fruits and veggies, unadulterated. Let me say that. So people say, "Oh yeah, I eat fruit, but I put sugar on it," or "I eat vegetables and I put salt and butter on it." So what does that do? You now turn a healthy, great food into an unhealthy food. So when I say fruits and veggies, it's in their unadulterated state, meaning how they come naturally. Having whole grains and high fiber, that also helps with our bowel, making sure we have regular and normal bowel movements. Oily fish, definitely helps with our heart. Eating lean meats, fat-free, reducing added sugar, because we'll talk in a minute about reading labels, because a lot of foods, unfortunately, come preloaded. If you're getting prepackaged foods, already come preloaded with sugar. And then, of course, not only to look at sugar, you also have to look at carbohydrates, which turn into sugar once they enter our body. Adding little, I would say little or no salt, probably more like no salt. They have a lot of great salt-free seasoning blends out there that can lend your food a lot of great flavor. And if alcohol, certainly do it in moderation. So it's the presenter, showing everyone it kind of is going all over my screen. So recommendations to reduce your risk: limit your intake of added sugar to no more than half of your daily calories, no more than half. So again, you have to be on the lookout for those sugars that you knowingly put in your body and those sugars that are hidden in some of the foods that you eat. So that's why it's a good idea to always read food labels. Limit your saturated fat to less than 7% and your trans fat to less than 1% of your daily caloric intake. Also, cholesterol is a biggie. A lot of foods have cholesterol, and a lot of things that we add to food have cholesterol in it as well. A lot of our butters and heavy creams and things like that. So we want to limit that as well. And of course, limit to no sodium in your diet. So you can make simple changes in your food choices and food preparation. If you can, there's a lot of great, especially in the summertime, you have a lot of wonderful farmers markets that offers fresh fruits and vegetable options. Also, if you're going to get frozen, ensure that you get those things that are flash frozen. And if you're going to get canned vegetables, ensure that they are low sodium vegetables. And if you're going to get fruit that's already prepared, make sure it's in light syrup. And if possible, choose a sugar-free or low-carb option. Whole grain products, and, it would be your beans, your fruits, liquid vegetable oils in place of solid fats, lean cuts of meat, again, grill, bake, or broil your meat or poultry, eliminating the need for frying, which only increases the amount of cholesterol that you may be ingesting. And of course, choose whole fruits and vegetables in place of juices. So make simple changes in your food choices and your food preparation. Watch out. As I talked about before, limit beverages and foods that are high in added sugars. So my suggestion is, if you're going to have sugar in your diet, why drink it when you rather eat it? Drinking, it's kind of a bit harder to track than it is with eating it. So just consider that, you know, when you're drinking, you know, to minimize the amount of sugar that you're drinking. Cut back on pastries and high calorie bakery products. Remove the skin from poultry before eating. And I know the skin is the best part. So, but in order to, again, to start promoting those healthier practices, remove the skin before you eat it. And of course, reduce your sodium intake by comparing sodium content of similar products using the nutrition label. And choosing varieties of processed foods that are low sodium. I cook a lot with chicken broth. And so I always go for the chicken broth that's low in sodium. So just being mindful of the things that you use a lot, because it can have a total impact on the foods that you're preparing, not only for yourself, but for your family as well. And so limit condiments and portion sizes. You would not believe how much sugar are in our condiments, especially ketchup. I had no idea that, I guess I should have, it's sweet. But you have no idea how much sugar are in some of the condiments that you utilize. So just be mindful of that. Ketchup is a biggie, and also looking at your salad dressings as well. You can pick up a lot of calories and fat in those things. So you take a nice, you say, okay, I'm going to have this beautiful, wonderful, healthy salad full of all the great things that you see here pictured in this picture. And then you go and you choose a regular salad dressing. So you may have taken that nice, healthy salad and added 2,000 or 5,000 calories to it just by the salad dressing alone that you put on top of it. So you got to start thinking about the big picture as well. So yes, great, you had the salad, but also the next step would be making sure, if you do put a dressing on that salad, to be mindful of it as well in terms of the caloric intake. So how many of you read nutrition labels? If you can just indicate in the chat, I'm just curious to know when you're shopping, how many of you actually look at your food labels? I'm doing it more than I have in the past. In the past, I have not, because you know, what tastes good? Fat tastes good, sugar tastes good, salt makes things taste a little bit better. So being able to definitely be mindful of what we're buying, it definitely goes a long way. And I see we have a question. Go ahead. Are you talking on mute? Was that an accidental hand raise?
It may have been a hand raise to answer your question, like I do.
Okay.
I said he reads the nutrition labels probably, yeah, which I think is great.
Absolutely, absolutely. Yep, thank you. So again, and I don't know how many of you may have children, but I am definitely working really hard with my teenage daughter on looking at not only nutrition labels when choosing foods, but also on portion control and portion size. So the biggest thing that I think a lot of people miss with nutrition labels is your serving size. So if you see that it says, like in this example, like all of the information that is included here is only for one slice. Let's just say that's one slice of cheese. So with one slice of cheese, the container contains 6 pieces of cheese, but of those 6 pieces, it's giving you the information for one. And so say you missed that and you ate all 6 pieces of the cheese thinking that you ate all 6 and you were only going to get 160 calories. Look at how you just did yourself a disservice and thinking you were only going to get 10 grams of fat, but you end up with 60 grams of fat because you ate all 6 pieces of the cheese. So reading food labels is very important. And not only that, The biggest thing you need to pay attention to is serving size. Because, you know, there are no bad foods in moderation. You know, I'm not saying you can't have your M&Ms, but look at the serving size. Don't have the whole bag of M&Ms. You know, it may say for 6 pieces, this is what you'll get, you know, with eating 6 M&Ms. So really pay attention to the serving size.
So, Dr. Sutherland, are you saying that I can't eat my 6 slices of red velvet cake all at one time? Is that what you're saying?
Yes, ma'am. That is exactly what I'm saying. So again, portion control. There are no bad foods in moderation. So if you had 1 slice per day versus all 6 at one time, then that is promoting a much more well-balanced diet and healthier lifestyle, of course. But I feel your pain, which is why I don't cook those things at home. Because I would eat, not only would I, again, I have a teenage daughter, she would eat them as well. And so spice it up. I must confess, during the pandemic, I developed a bit of a spice addiction. I didn't even count the bottle of spices here, but if I had to guess, I'd probably say I have maybe about 60 or 70 spices that I accumulated during the pandemic because you know, they have a way of enhancing the flavor of your foods. Now, let me just say this. Always look at your ingredients on your spice blends, because sadly, the very first ingredient inevitably is always salt. So what I have started doing is actively seeking out and looking for those spice blends that are salt-free. And a lot of them will tell you on the label that they're salt-free. So imagine if you're using, let's just say you're using 3 different spice blends, and all of them contain salt. So what you've essentially done is you've increased the amount of sodium in whatever, exponentially in whatever dish that you are preparing. So while spices are great and good, just read the label and ensure that you know exactly what you're getting. You know, and some spices still contain MSG, which we know is not good for you. So just always read the ingredients. And I'm going to say this, if you have spices or a blend or whatever, and you're reading it and you can't pronounce or don't know what any of the ingredients are, I would strongly encourage you not to eat it, because it's some sort of manufactured chemical that's not good for you. So a lot of the spice blends, well, all of the spice blends that I use are typically just blending together of individual spices that I have as well. It's just a matter of, you know, how they're kind of blended together to achieve whatever flavor they're trying to promote. But the biggest key takeaway I want you to take from this is, with your spices, especially the blends, always read the ingredient, because inevitably, unfortunately, salt is usually the #1 ingredient. And so, of course, when you're looking at commercially prepared foods, you know, or in recipes, you know, check the sodium content. That's a biggie. And of course, again, you're at the farmer's market getting your fresh fruits and vegetables. Pick up your herbs and spices as well, fresh from the farmer's market. Or if you have a green thumb, which I don't, you can grow your own. I'm told that people are successfully able to grow their own spices. Has anyone grown their own spices? If you can just respond in a chat, that'd be great. I attempted. I think the 3rd time's a try. I'm gonna try again. I have seeds for cilantro and parsley. So me and my daughter, we're gonna replant again. I don't know where we went wrong with. So if anybody has any tips, please put them in the chat. But growing them, of course, is definitely a healthy way to go. And I'm telling you, for those who may not use fresh spices, they are 100 times better than the ones that you buy in a jar, especially like, say, your parsleys and your cilantros and your rosemary and things like that. Buying them fresh it just really takes your food and your recipes to the next level. Okay, so 5 tips for success. Make eating an activity in itself. Is eating an activity, or is it just something that you do to survive? Be a list maker. When you go to the grocery store, do you have a list, or do you just kind of pick the things that you like without looking at the labels? Never ever, you heard the old adage, never go to the grocery store hungry. That's true, because you end up buying a whole bunch of stuff that may not be healthy for you because you're hungry. Focus on what you can do in terms of what are the changes that you can make. And we have control over what it is we put in our mouth. That is something that we have control over. As we talked about those non-modifiable risk factors, we can't control, you know, our I'm going to say this, our gender, to the extent that genetically what our gender is in terms of those risk factors. Stay positive. Stress, remember, stress is a killer. You know, in terms of increasing your blood pressure and things like that. And of course, take baby steps. Don't say, I'm going to go home and throw out all of the bad foods in my house and I'm going to instantly start eating healthier. Doing that only sets you up for failure. So take baby steps. So losing and maintaining weight loss. The first thing I would encourage you to do is talk to your healthcare provider, and you should be making a plan together. Like, say your goal is you have hypertension related to your sedentary lifestyle or obesity. So don't stop taking your hypertension medication. Work with your doctor on a plan that could potentially lead to weight loss, which could ultimately maybe lead to you not being hypertensive. So sit down with your provider and make a plan and let them know what your goals are and how you can work together in order to achieve those goals. Be informed and know your body mass index to achieve a steady weight loss. You know, eat 200 to 300 calories less each day, and 60 minutes of physical activities most days of the week is recommended for adults such as ourselves, you know, wanting to lose weight. But if you are wanting to just maintain your weight, then 30 minutes of physical activity most days of the week is helpful. So I will ask this question. With the advent of COVID, and I'm not sure how many of you may have transitioned to working from home. I was already a full-time work at home person. Do you find that you have infused physical activity in your day, even though you're at home, which could lend to a little bit more freedom to include physical activity than, say, in an office setting? Do you find time in the middle of the day to, say, go for a walk? And you can just respond in the chat. I have 2 dogs, so I try to the best as schedule would permit, I try to take them out at least once, sometimes twice a day, for at least 20 to 30 minutes, more for them and for me. Again, and also, you know, if you work in an office at a desk, sitting in a chair all day, that right there puts you at risk for heart disease as well, because you have a sedentary lifestyle where you sit for hours and hours on end. So that's why it's a good idea to get up during your work day. I know a lot of companies offer standing desks, you know, so being able to stand versus sit. I've seen some people get rid of their office chair and have the exercise ball that helps definitely with strengthening your core and your posture when sitting on the ball as well. And I've even seen where they have treadmills that are, your desk is like the treadmill. So people are walking while I don't know if I could have that kind of coordination. Maybe if I was just listening on a call, I could, but if I'm having to type and think, I'm not quite certain I'm that coordinated to be walking on a treadmill and working at the same time. But those are just a few of the things that you can consider doing throughout your workday in order to get moving and be physically active. So 3 important reminders about weight loss and maintenance. Weight control is a lifetime project, which is why we don't say, you know, I'm going on a diet. No, we're looking at lifestyle management, how we can change and modify our lifestyle by promoting healthier behaviors, ultimately leading to a healthier you. So short-term rapid weight loss diets usually fail in the long run. The key to a long-term success is, of course, lifestyle changes. And it has to be, if you are married and have children, it has to be a lifestyle change for everyone. It can't just be for one person. It has to be a family lifestyle change as well. So how do you begin? Oh, you're like, oh my God, I need to lose 50 pounds. Do I set a goal initially of losing the 50 pounds all at once? No. what I would suggest is that you break that up into 10-pound increments, so that as you're losing the weight, you can celebrate your wins with every 10 pounds, rather than saying, oh, I feel I only lost 20 pounds of the 50, so I feel like I haven't achieved my goal. So setting realistic, attainable, small goals to help you get to your larger goal certainly sets you up for success. And so how do you begin? You can increase your exercise. Again, stand when you could sit. Instead of sitting, stand as well. If you can't run, walk. Walking is always a great choice. Make the right choice as well. Lift yourself up. I like this. Lift yourself up one bite at a time. Sometimes, we struggle and fall down on a journey, but, cut yourself some slack. Again, it's not about doing everything right perfectly in the beginning. It's about making a lifestyle change. And think about the habits that you have to break. Say you're the person that whenever you get your meal, you always put salt on it. So that's a habit that you're going to have to learn how to break in order to, again, promote decreasing sodium in your life. And so avoid the white. That's white flour, white sugar, white bread, and white rice. And so instead choose more of your whole grain breads, oatmeal, your dried fruits, not those dried fruits that have sugar added. Sugar is everywhere, sugar and salt. So you may have, I don't know if you've seen like dried apricots, but you must read the label. A lot of them have sugar and salt in them. So again, reading labels is critical. And stay the course. Stay colorful. Does all your food look the same? Is all your food the same color? It shouldn't be. You should have a myriad of colors on your plate. Because of your different fruits and vegetables that you're eating. Protein power. Keep healthy protein around. Your skinless turkey, your hard-boiled eggs, your nuts, your seeds. Eat consciously. Don't just eat out of habit. How many of us eat out of habit? Sometimes, you sit down, you're watching TV. What do you want to do? You want to eat. And are you eating healthy things? Not at all. You're eating popcorn, you're eating potato chips, you're eating ice cream, you're eating cookies. So be conscious about eating when you're doing certain activities as well. Drink water. How many of you got water? Now you probably can't see it with this Zoom. How many of you got water? Raise your hand if you got water within your arms. Very good. Wonderful. Wonderful. A lot of us are dehydrated, and you wonder why sometimes you're so irritable. You got a headache, you having digestive issues, you're tired and lethargic and sleepy all the time. A lot of it is related to our hydration status. So ensure that you are getting enough water, and no soda, and that's no. I had this same debate with my daughter. Isn't soda made out of water? No. Pure water. How many of you add fruit and different things to your water? I do lemon and strawberries in the summer. Sometimes I put in a little bit of mint to enhance the flavor of it, so that it just is not plain water. So I'm trying to really work on that with my daughter and don't put, so if you put the lemon in there, don't put any sugar in there, because then it becomes lemonade. So you pretty much defeat the purpose of drinking water. So just like a hint of it for the flavor as well. Variety is the spice of life. Snack better. I'm not saying you can't snack, but get better options like baked chips and not fried. I'm not a huge fan of baked chips, but that's an option. And to the extent, eat your fruits and vegetables fresh rather than getting them in a jar or a can, especially in the summertime. As I mentioned, all those farmers markets. Eat slower. Take the time to chew your food well, and you will eat less. Remember, it takes about 15 minutes for our bodies to feel full. So if you're shoveling food in your mouth, you theoretically are already full before your body signals to you that you're already full. And in most cases, what happens? You're over full and you're miserable. So eat slower and and chewing is very, very, very important. Make sure you chew your food up very, very thoroughly. and meditate mindfully. Take time to get in touch with your inner self. Breathe deeply. I have an Apple Watch. I don't know how many people may have a smartwatch, but I actually have a setting on my watch where it reminds me to breathe all throughout the day. You can set it to remind you to stop, take a breath, breathe, focus on you, and then continue on with your day, rather than being in a hyper state of stress the entire day. So I'm not going to go through this in its entirety. I mainly put it here so that you could have a reference for it as well. Consider doing a weekly walking plan. So it just kind of goes through, you know, what you would do in order to start this walking plan. So, you know, start it with rest, and then, you know, you may end up, you know, doing some interval workouts. You know, Wednesday might be your recovery, where you may do a moderate walk. Thursday might be your threshold workout, where you focus on speed. Friday, Saturday, Sunday, like so. And so you may also, you know, as you walk more, you want to definitely increase your distance. How many of us track our steps? Everything we have tracks us, right? Our cell phone, our watch, all those things track us. It tracks our movement, and it has the ability for you to be able to monitor your steps. I just recently entered into a group of friends. We all have Apple Watches, so you can create a group. And in that group, you're able to see what everyone is doing. You're able to see their steps. You're able to see their exercise. And I think that for me, it serves as a motivation. You know, you don't want to be the only one in the group that has 0, 0, 0. So it has definitely incentivized and encouraged me to take my reading from 0 to actually have steps and things like that to be able to report as well. And so, how many of you meditate or have meditated before? Okay. I see some of you have meditated. Let's see how I can, let me go back. Okay, yeah. So a meditation that you can do. So they also have, and I will, if I haven't, I will place in the chat a link. There are meditation apps that you can buy. A lot of them are free. And so you can have mindful moments at your desk. You can say 20 minutes every day, I'm gonna have a mindful me moment sitting right here at my desk. And there are several apps that can assist you with having that guided meditation as well. So stay encouraged. Do a little more each day than you think you can possibly can. The foods we choose make a difference. Absolutely. You know the old saying, you are what you eat, where you are. Okay. And with that being said, I'll open the floor up for questions that anyone may have. I know I gave a lot of information. No one? So I did a fantastic job. I gave you all the information you ever wanted to know about heart disease and all of those things that you can do to promote a healthier lifestyle. So one thing, let me see, I will include this in the chat, this link for meditation. So this is a site that lists all of several meditation apps, and they're available in the Google Play Store as well as in the App Store. So I would turn it back over. I see no one has any questions. It's been a pleasure speaking with you about a subject that is near and dear to my heart, because I'm actually in the throes of it. Again, having a teenager, I want to make sure that she is cultivating those good habits. So in a few years when she's out in the real world, hopefully some of it will stick. So thank you so much. I'll turn it back over to our moderators.